Hello, everyone. Very good afternoon to everyone. And today I am here to do a very special interview. Let me introduce myself. I'm Dr. Rajeshwari from SL Raheja. I'm the medical coordinator. And today we are going to talk about this very burning issue, which is, we can see all over India, which is the increasing like pollution and all, as well as degrading AQI. We have with us here Dr. Vaibhav Kubal. He's a consultant chest physician and he's associated with SL Raheja for the past 10 years and he's fixing patients' lungs here. So he's an expert in that. We would love to hear from him, about how we can actually deal with this issue and how we are going to go about it since it is a burning issue nowadays. A very warm welcome to you, sir. I'm going to begin with asking you that why do you think respiratory health is so important in today's world?
So first of all, thank you, Dr. Rajeshwari, for giving a very kind welcome to me on this show. And yes, like as you rightly said, pollution is something that we are grappling, and respiratory health is important, right? We all watch movies, and you must have heard of this dialogue. आज मेरे पास गाड़ी है, बंगला है, नौकर चाकर है, and that is what is the sign of luxury, being rich and all. The perspective has changed. आज लोग बोलते हैं मेरे पास एयर प्यूरिफायर है, मेरे पास ऑक्सीजन कॉन्सेंट्रेटर है. So these things have become a norm nowadays in metropolitan cities like Mumbai, Delhi, and yes, respiratory health is very important. As we are talking, we are breathing. Our bodies are utilizing the oxygen which is present in this room. How is this happening? Without, and the amount of energy consumed to do this is very, very less. It's a very efficient system. We are breathing almost 10,000 liters of air in one single day. 10,000 liters of air. And
Wow.
that air is passing through your lungs every minute by minute, and our lungs are efficiently able to pick up the right nutrients from the air, deliver it to the body. The body is growing. So respiratory health is very important. The mechanics that have been set are so appropriate and efficient, are so efficient that it requires very less energy to get optimum results. But in today's scenario, so one question is something it's very intrigues me. So we know that we all need oxygen to survive, isn't it, Dr. Rajeshwari? Do you know
Absolutely.
how much oxygen is there right now in the room that you're breathing in?
Sir, I'm sure with the increasing pollution and the rising, the degrading air quality index, it is going to be really. I mean, the oxygen saturation is actually going down.
Yeah. So basically, in this particular air and the room that we are breathing in has only 20% of oxygen in this air. We need only 20% of oxygen in the air that we breathe, out of which our lungs are supposed to snatch this oxygen, give it to the rest of the body, right? So the question happens, what is the rest of the 70-80%? That 70-80% are other gases, nitrogen, suspended particles, and all those stuff. So your lung, any which ways, in a healthy environment also has a very efficient function to do it, to take the oxygen, to filter the the pollutants, to filter the dust particles, and as I told you, very efficiently it has been constructed, crafted for us. Now the problem with us right now is the particulate matter of the air has gone so high that this entire system is coming under crash, is getting inefficient, and that is where the problem is, right?
Right.
So
Right.
when you talk about rising pollution, an efficiently functioning system is coming under attack, and that is the reason why we are getting all these problems.
Absolutely, sir. And I think everyone would really want to know. See, we know this term air quality index, and
Yeah.
respiratory health, of course, goes along with it. But this term is like a very short term. But then, of course, people would love to know from the chest physician himself that what exactly it means. So
Yeah.
please, sir, enlighten us on this.
So air quality index is a numerical term, right? We cannot decide or see or smell the purity of air. We cannot do that. So there are ways to find out whether the air is pure. What do you mean by pure? That means oxygen is 20%, nitrogen is 70%, carbon dioxide is whatever percent. So the normal atmosphere, the constituent of the atmosphere, are they same or has it changed? Depending upon the unwanted substances which increase, the quality of air is decided, right? So
Right,
what happens? So normally a normal scenario, the air quality index of 50 is considered to be a very good quality air index. Anything
okay,
above 150, 100, 150 is something which can cause respiratory health issues. For me, if you ask me, the gradings are poor, very poor, and very severe, and all those things, but they really do not matter after one particular time. The more the number, the worse the
so
problems
what's
are
the
more and more.
situation?
They're directly proportional, right? At a very, we
Correct.
are talking about AQI as 600 and 400 and 500. I think these are some insane numbers that we are talking about. The kind of explanation that I gave you about the lung functioning,
Correct.
it's very difficult for me to imagine the stretch of work that our lungs need to filter this. It's is as good as filtering your ACs when you do a maintenance of your AC and you remove your filters and you see a lot of, so all these things are happening in a human body. It's very difficult to imagine. So when you talk about air quality index, it talks about impurities which are present in air above a particular number, right? And what are these impurities? That impurities can be gaseous impurities, it could be particulate matter impurities, right? Gases like carbon monoxide, ozone, sulfur dioxide. And there is a very important term along with AQI people keep talking about, Dr. Rajeshwari. It's called PM 2.5 or PM 10, right? So it's
Yes.
very important to understand what that means, because as we are sitting here to talk about it, we should know what PM 2.5 means, right? So PM stands for particulate matter, and 2.5 remains is the size of that particulate matter. So why is this important, 2.5, right, to 5? So as we understand the lung physiology, when we breathe in air, the air is going from the windpipe into the branches of the windpipes and finally appearing in the air sacs. Right? They are
Right.
filtered at level, and below which the important gases are taken into the blood vessels, and this is how we provide the nutrient to the rest of the body. Now,
Right.
any particle size which is more than 5 microns is usually filtered by lung, very efficiently filtered by lung, right? Because it will never reach down, it will never get entry into our body. Suppose if this particulate matter is less than 5, which is 2.5, 2.5 is less than 5. What
Right.
happens? They have an easy gateway access to open and enter into the blood vessels, right? So the filter mechanics don't work at that particular matter size, right? And that
Right.
is where the problem is, where these particulate matter have an easy access to the blood vessels, and once it reaches the blood vessels, it is exposed internally to various organs, right? It can go
Right.
to the lung, it can go to the liver, to the kidneys, to the what all things, the heart, vessels, everywhere. So particulate matter 2.5 is a different index that is also measured along with AQI, and that is why it is important for us to understand about particulate matter 2.5. Raj.
Yes, sir, absolutely. And just 2 days back, news hit the headlines that smogged out India versus South Africa match has been abandoned due to, degrading air quality index. That is like 411 was the number given. And I think So we on one side we have upset and die-hard cricket fans who are really upset because of this, and on the other side, of course, hazardous situation, environmental crisis, I can say. So, what do you have to say on this?
No, I just have to say that I hope you had not bought the tickets for the cricket match.
No, 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 sir. I had not. I'm not a
Yeah, so
die-hard cricket.
it is difficult, yeah, right, to breathe normally in an AQI at 400 is difficult. Imagine someone is playing, someone is running, someone is doing morning walks at that. It is definitely you increase your oxygen ventilation, your air amount of air going into your lung increases. You are exposed to a lot of these problems, and AQI doesn't only affect the lungs. It basically, you need to understand, AQI probably affects every organ of our body which it faces or which it comes in contact with, right, starting from its eyes. Right, eyes are the most sensitive part. They are exposed to the AQI dust particles, so you feel irritation of your eyes, you feel itching, they keep watering all the time. So eyes is one. Second is your nose, right? So the air that you breathe, the first contact comes into your nose, though your nose is heavily protected with its protective mechanisms to tackle all these things, but not all the time. So you may have runny nose, itchy nose, sneezing, pain in the sinuses, constant headache, throat. From the air, then it goes to the throat, and again similar kind of irritations and itching. Lung probably is the only organ which is deep seated in our body but still exposed to the external world, right? Most of our organs are internally built and they are not exposed, except for the lungs and our stomach. Stomach is also something that you can eat outside and goes internally. So anything that an external factor can affect a deep-seated organ, yes, AQI will be, and that is why lung comes into this in this scenario where it gets affected. The other is skin, of course. Though we don't come across many of the skin issues regarding air pollution, but then yes, I do not know what scale are we moving ahead and what kind of things that we are yet to see with this area. So so it is always not advisable to practice exercise, to do morning walks and certain times when the AQIs are high, and the reason for this cricket match was for the safety of the people as well as the players. So
Absolutely.
yeah, so I think that that was the right call. And even in your day to day life, Rajeshwari, if you're someone who's into morning walks or into this thing, you should be mindful of when you want to do it, right? You wouldn't like to do it when the AQI is really high. You would find out time, not the early mornings, not the late evenings, maybe probably when the sun is very shining, or maybe indoor activities. Or we need to plan it that way, Rajeshwari, Dr. Rajeshwari.
Right, right. Yes, sir, absolutely. Portrayed. But at the same time, but this is not only, we are, one thing I have observed personally that earlier when we used to take medications for upper respiratory tract infections, the infections used to subside in 2 or 3 days max. But now I see that even after taking a lot of medications and trying out different things, the infection doesn't subside easily. So, what is the cause of this? I mean, what do you think is happening? Are the medications not working, or the infection, which is you know like we are facing with this issue of
Yeah.
pollution? So maybe because of that, it's
Yeah.
continuous and it's not a thing where we put a full
Yeah.
stop to it. Is it because of
So
this?
I think a very correct observation, Dr. Rajeshwari. I think we every one of us probably may have one or two patients, not patients, but family members who will be having these infections and they are not relieving. So there are twofold reasons for this. We are already in a flu season, right? We are into winters. The
Absolutely.
level of viral infections are high, And yes, so we call it normal flu or common flu as we rightly term. So what does common flu mean? You have flu, you you have probably fever, cough, whatever for 2 3 days. You rest. The fourth day you are fine. You start resume your work, right? But
Absolutely.
that's not the case anymore. We
Yes.
the cough, the symptoms, they are lasting for more than 2 weeks. They are not patients are people are not able to go back to their work, and very sadly, it is happening to people who do not have a existing lung problem, right? So.
Yes.
Though so my perspective about this is definitely we started that the entire process started with an infection, but it never ends with an infection. It ends with an inflammation. So that's the problem. So when we are exposed to any infection, your body is trying to fight it out. When it tries to fight it out, it causes runny nose, it causes mucosal edema, everything. But at the same time, it is hit hard by other irritants also, which are present in the air that is around us. With an AQI of more than 150, even normal people get issues. Imagine people who are infected and tackling through flu. So it is just not the flu, but it is also the irritants around us, which is causing to prolong these symptoms and well-being. And we see patients possibly after 2 3 weeks. So basically, being a pulmonologist, we see patient quite later in the time. They will be visiting the family doctors. The family doctors will give them symptomatic treatment, hoping it to be better for the next 2 days, 3 days. It doesn't settle. Then they are on antibiotics. Then they take a 5 day course of antibiotics. They don't do well. Then again, they think of changing into a different doctor. They go to a different doctor. They take one more set of antibiotics. So, and then they don't feel well. And then is the time when they realize, no, I think things are more than what we think, and we need to meet a specialist at this point in time. But we need to understand that it is not an infection where an antibiotic can take care of, right? It is the inflammatory process that is taking time. And yes, there are ways to address it. There are certain, and I don't mean ways to address doesn't mean that there are medicines to address. There are some lifestyle things that you can do. There are many things that we can just change the way we are doing, and things can be sorted. So I suggest that yes, these are times where normal flu or common flu is no more common anymore. It is not normal anymore. Rather, it's something that people stay with, live with, and they need a little extra attention, and they need to see a specialist after 6 7 days if they are not feeling better, or probably if they are feel that they are progressing in their symptoms, they should visit a specialist to address their issues.
Absolutely, sir. And also, sometimes people don't complete the antibiotic dose. So that also causes the resistance, drug resistance, and then that's how the infection also, even if it reoccurs, then the medicine doesn't work because
Absolutely, Dr. Rajeshwari. I think that's a very well point you pointed out. Antibiotic is not the solution, but multiple antibiotics is definitely the reason for a bigger problem. So you should be mindful of what we are giving to our body, because your body is going to be blind and metabolize everything. It is just that we need to be mindful of what we are trying to solve the problem with.
right, right. And what precautionary actions can we take uh, for safety actually measures we can imbibe so that we don't really get exposed to such high levels of AQI and
So, Dr. Rajeshwari, before we come to the safety point, I think first let us understand what are the impacts, right? What are the
correct.
impacts of this rising pollution on our lungs and all? So, this is my personal opinion. Being in this specialty and looking at so many X-rays and patients and lung functions, to this is a very complex question, and there cannot be one single answer. How does the air pollution impact lung health? So before that, let us talk about lung health. So as we grow old, your lungs are also growing old, right? So from the time when we are born up till your adolescent 15 16, your lung is growing healthily, right? It is
Right.
supposed to grow, it is aging. Now, when a AQI, a high AQI at that point of time has a different event, right? Has a different effect. It affects the lung in a different way. How come? So basically, when the kids are small, when the babies are small, they are very small tubes, small air tubes. So they get clogged very quickly as compared to any adult, right? They are any which ways their immunity is on the lower side. They're exposed to so many viral infections, which increases the propensity for these problems. Again, they are growing. So when they are growing and someone is hitting hard at that point in time, the growth is affected. So there are chances that in a highly polluted area, a child's lung health is at as a problem, right? Someone, a kid which is growing around an industrial area, his lung health will not go to his maximum potential, what it can
Absolutely.
be at the age of 16 to 18.
Correct.
And these are detrimental effects. These are possibly, I won't use the word irreversible, but definitely non-reversible changes. Something happening at this point in time in a growth for this thing, definitely it will affect its growth. The long term, the long term improvement in the lung functions is also an issue. So that is about the adolescent age group. By and large, after in the adulthood, the lung functions are stable until you are 31, 30, 30 years of age. After 30 years of age, Dr. Rajeshwari, you'll be surprised to know normal lung also decline in function, right? This decline is very minute, but it still happens. It's at the scale of 5 to 10 ml per year. It's a very small decline, but it
Okay.
happens. So anyone, even anyone who's normally growing without a atmosphere pollution and all those things, at the age of 55, 60, the lung age has declined at a particular time. It is not the way it was when it was 45. It is not the way when it was 35 years of age. Correct? This is the time where usually the lung is in a better position to handle air pollution, and that is why you don't see people at this age getting seriously affected with this pollution related issues.
That's
The
right.
problem comes when you're aging at 60, 65, and where your lung functions are seriously declining and are reduced. At that point in time, again, such irritants will have detrimental effect. So, from a normal healthy person perspective, younger age group and the elderlies, this will have the maximum impact on the respiratory health. Just to summarize this, correct? Now,
Okay.
let's add one more layer of complexity to it. Suppose if there are patients who are already having any respiratory problem,
Any
like
respiratory, yes,
right,
disease.
like
Yes.
asthma, COPD, interstitial
Correct.
lung disease,
Correct.
it adds a burden, one more layer of burden to the normal decline of the problem. So whenever someone who is having a pre-existing lung disease, the genesis of that problem is such that they are prone to get exacerbation. The exacerbation meaning flare up of their existing problem. Right?
Yes.
They are prone, but when you are subjected to a polluted area, definitely the number of flares increase, and every
Absolutely.
time the flare increase, your lung functions will go down. So they add a different level or probably an added level of problem to this to the existing problem. So this is what the impact of lung the air pollution can have on a normal lung, on a diseased lung, on a young lung, on an adult lung, or on an elderly lung. So we should be mindful about treating all these various types of things that I spoke about. Now,
So,
what
do
can
the
sorry.
sorry to interrupt you, sir. Do
Yeah.
the air purifiers work really help in this situation?
So again, as you talked about prevention, right? So
Hmm.
prevention purifier definitely comes into the this thing, but definitely it is not the first thing that you should do. Not the first. First is self prevention. What can you do to prevent your own self, right?
Prevent. Yeah.
Right now, nowadays we have enough apps or on our phones that we can understand what the AQI is. provided where you're living, which part of the city you're living. You can manage your AQI at your around your place. I'm not talking about Mumbai's AQI is this much, Delhi's. You can tailor it down to as good as Dadar AQI, Vileparle AQI, and all the stuff. So, and which part of the cities that you live in. So, accordingly, you plan your day. Your day is very fixed. You wake up, you whatever you have your training, you go to work. How do you go to work? All these things are very important. Usually, AQI is high in times when the day is colder. So, by and large, there are two times: one early morning before the sun is up, and evening when the sun is set down. So these are the two high likely where the dust particles in the atmosphere are high, and the AQI is generally high during this time. So depending upon that, you should plan. So depending upon that, you have various avenues. You can work out indoor. You can try to change your time of your indoor. When it comes to working time, you can decide to travel, when not to travel. You can, if you have an option from work to work from home, consider that work from home. If your house is more polluted, you go to the office and work. So that becomes an other option. So I think it has to be a tailor-made approach if it comes to the self-protection. Another thing is, using a mask. So I see people using various kind of mask. I think any kind of mask definitely gives you protection, but efficiency wise, like which is the recommended one, would be N95. In COVID days,
Correct.
before COVID era, no one knew what N95 meant. But in
Yes.
today's world, everyone understands what N95 means. So N95 is a reliably good. So if you're walking on roads, dusty road, I think it's fair enough. Again, people who have existing problem with respiratory, they may not be able to tolerate N95 very easily. So they may have to probably not use N95 because they may feel very suffocated. So that is the second part. Third part is if you are suffering from any respiratory problem like asthma, COPD, you should be very careful about you being on medications. Your regular medications should be there. You should not be skipping. Your doctor's visit should be regular. It's a
Correct.
good idea to visit the doctors during this time, even if you are stable, just to say a hi, hello, and see if things are okay, and so that you don't land up in the hospitals with sickness. And of course, vaccinations is something that we should be doing so that there is no flu or the impact of flu is less, so the pollution related issues also become less.
Absolutely, absolutely, sir. So recently there are these memes also which are circulating about Delhi that if a yoga instructor, if she says take a deep breath, she will be booked for murder, attempted murder. So, such kind of things are, that's how things are going about nowadays. So,
Yeah,
yeah.
yeah, I
So,
think yeah, of course. So I think, yeah, I think see, we live in a world like this. You mentioned about the purifiers also. So yes, purifiers definitely help, but if you have a reasonably good air conditioning, which you can filter out many, you may not require. Air purifiers are not very highly efficient, but the way we use it in the hospital setting. But for whatever purposes you want to use it, yeah, it might not solve the entire purpose. What the term air purifier doesn't mean it is air is purified, right? So it
yes.
purifies to a reasonably better levels, I feel.
Correct, correct, correct. So,
Yeah.
yeah. So, but what role can a hospital or clinicians play? During such high pollution days, like what can we do?
So I think, Dr. Rajesh, you've taken the first initiative steps that doing this meeting or a very short meeting,
Yes, absolutely.
and then you had this thought process on how can we do this. I think this is the first step that we seeing the patients very regularly, understanding the problem crux. Is there an understanding problem? Where is the treatment failure? Something. I think first step is I was raising the awareness, which I think you are very rightfully contributing to it. From a physician point of view, I think they should be explaining in their regular visits of, oh, there is going to be winters, or there is going to be an AQI problem. So start pre-preparing, right? Have an action plan laid. So that is what we do. Rather, I prefer doing is having an action plan, right? Don't wait for things to go out of hand. If they are slipping out of your hand, catch hold of it. Regular visits, nutrition, hydration. I think all these things definitely I'm more happy to see a patient who visits me just to say a hi, in these months, rather than falling sick and coming and meeting me. So I think we should encourage that kind of culture in the patient groups that we have.
Absolutely, absolutely,
Yeah.
sir. I think you have wonderfully put every all the points, rightfully said, and I think it was wonderful having you and your valuable insights. I think everybody is going to really, take a lot from it, because nowadays this is really, I mean, everybody. I'm sure everybody is struggling with these issues nowadays, and thank you so much once again for being here and helping us.
Thank you, Rajeshwari. It was wonderful talking to you. Thank you.